Hello, my name's Diana Parkinson and I'm going to take you through a brief session looking at the theory of change model and its use in a planning and evaluation context. The presentation will cover what a theory of change is, what the benefits and challenges are of developing a theory of change, what a theory of change may look like, guidance on how to go about creating a theory of change, and ideas on where to get more information. So a theory of change is a description of how an initiative works. It shows how change happens in the short, medium and long term to achieve the intended impact. The theory of change model is a good way of planning new initiatives or of working out how to measure the outcomes and impact of ongoing work. This means it can be used for both planning and for evaluation purposes. It's often presented as a model or a diagram, but what's important about using theory of change is actually the thinking, often captured in a narrative, that accompanies the visual presentation. There are lots of benefits to using a theory of change approach. Above all, it should give you a clear and testable theory about how change will occur, which is particularly helpful in reflecting the complexity of change. It can also enable you to develop a visual representation of the changes you want to see and how you expect them to come about. It can also help to get your stakeholders to agree what success means for your work and what it takes to get there. And finally, it can serve as a powerful communication tool to capture the impact of your work. Also, challenges to be aware of. It's a complex process that takes time and commitment, particularly if you're involving your stakeholders, so it's not something you can do in 10 minutes. Creating a theory of change involves thinking about the sequential order in which your outcomes occur, and this can be hard, particularly as change does not generally occur in a linear way. It may happen in different ways and at different times for different people. There may also be little evidence available on which to base the connections you're making between your activities, outcomes and impact. You may have to base these on your own knowledge of your work or look for research in other settings that may help to justify the connections you're making. Finally, although the thinking process involved in developing a theory of change is extremely helpful in identifying outcomes and impact, this doesn't necessarily translate clearly into an evaluation framework, shown below, where you have a set of outputs and outcomes with indicators that you can help to measure progress and a plan for your data collection. But it can help you to get there. So what does using a theory of change approach involve? Developing a theory of change involves defining different aspects of an organisation's work and thinking about how each one leads to or affects others, as well as teasing out the assumptions on which this theory is built. So you start by thinking about the problem or need that your work is seeking to address, which in a sense correlates to your impact, i.e. the bigger picture. This then helps you to identify long-term aims or goals, and working backwards, you can then think about what changes, i.e. the outcomes, will need to happen for these aims to be achieved. Knowing then what immediate changes you want to bring about helps you to plan the activities, i.e. the outputs, and the resources, inputs that will be required. In some ways, this is of course similar to the way in which program logic models work. As you can see here, program logic models are based on a theory which shows how the inputs of a project or organisation, such as its staffing or finances, are then utilised through the project's processes, i.e. what it does behind the scenes to set up and maintain its work, things like staff training, volunteer recruitment, so that outputs, the organisation's services and activities, can be provided to its users. These outputs then affect change, its outcomes, which in the longer term and in combination with other interventions can lead to impact, i.e. broader change that happens over a longer period of time. On the other hand, as we've seen, a theory of change starts with impact and works backwards. So it begins by thinking about the broad problem that needs to be addressed and then considers how this links to longer term aims and outcomes, which in turn define the activities and inputs that will be required. Theories of change are often produced as diagrams. Here's an example of one produced by the NSPCC. This theory of change was produced by the NSPCC for their work with families affected by domestic abuse. Their theory of change starts at the top and shows how the problem their work addresses, the impact of experiencing or witnessing domestic abuse on mothers and children, and its underlying issues, that families struggle to talk about the abuse and that mothers who've been abused are not always able to provide the support their children need, inform the service they provide, which then leads to outcomes, such as a better understanding of domestic abuse and of healthy or unhealthy relationships, and then longer-term impact, e.g. the mother and child are safe from further domestic abuse incidents. So it's not necessarily presented in the order that it was developed, but that's also the point of theories of change. They're a versatile model that you can make work for your own organisation. What's important is that underpinning this diagram is a narrative, a theory that explains and evidences their thinking for the theory of change that they present. So in terms of what developing a theory of change involves, there are 6 key stages. Firstly, it's about identifying the problem and the underlying causes that your work seeks to address. Then it's about deciding on the overall aim or aims that you'll work towards in order to tackle the problems you've identified. Then developing outcomes that will help you to achieve these aims. Next, identifying outputs or activities that are necessary to bring about your outcomes. And then considering the inputs, i.e. the resources needed to provide your services. And finally, thinking through the assumptions that underpin your theory. So we'll work through each of these stages in a bit more detail. So step 1 is to identify the problem and the underlying causes that your work seeks to address. This might involve using existing research or looking for evidence that supports your theory that your intervention will have the results you aim for. Or it might involve consulting with your users in order to understand more about the fundamental problems they face. Equally, it can be done from drawing from your own experience or that of your stakeholders. So if we look at the NSPCC example, they've identified the problem they're addressing as the impact of experiencing or witnessing domestic abuse for mothers and children, which is associated with families struggling to talk about the issue after it's ended, so that trauma is often not acknowledged or addressed, and mothers not always being in the right place to provide support for their children. The next step is about identifying long-term aims that address these problems. So these are likely to mirror the issues that you've identified. So, for example, if the problem identified is the impact of experiencing and witnessing domestic abuse, then the aims might be to enable mothers and children to acknowledge and address the domestic abuse they've experienced, and to enable mothers to better support their children. It's important to remember that your aims are high level and describe broad areas of change that your work will bring about. So the next step is to identify outcomes that will help to bring about these long-term aims. To do this, you'll need to take each aim in turn and think about the changes needed to achieve this aim. So, for example, the outcomes that relate to the first aim, to enable mothers and children to acknowledge and address the domestic abuse they've experienced, are that mothers understand better how their children were aware of and affected by the abuse, and that mothers and children have a better understanding of domestic abuse itself and of healthy and unhealthy relationships. And in terms of the second aim, enabling mothers to better support their children, outcomes might be that mothers improve their self-esteem and confidence in their parenting, and that they begin to recover from the abuse and are in a better position to support their children. It's important to remember that your outcomes are specific changes that occur as a result of what you do. So it can be very helpful to think carefully about how you express your outcomes. Defining outcomes involves thinking about how to express change for specific groups, e.g. policymakers, practitioners, or young people, or in specific areas, policy or practice. It often helps to use words such as more able to, increase, reduce, and so forth. So when you write your outcomes, try expressing these in terms of each of your stakeholder groups or areas and the specific changes you hope to bring about for them. It's also important to consider different perspectives when you develop your outcomes. So you may turn to your service users, your commissioners, or even to research that's been carried out. And remember that your outcomes must relate to your interventions. They shouldn't just be vague goals or value statements. They also need to be different from your outputs, which are the actual services you provide, the things that you do, and focus on change for your service users or in your target area of work if you're thinking about policy change. The next step is to identify the activities, i.e. the outputs that you'll provide in order to bring about the outcomes you've identified. So your outputs describe the activities or services that you provide for your service users. If you like, they're what's on the menu for them when they engage with your service, workshops, one-to-one support, and so forth. So in order for mothers and children to understand more about what they've experienced and how it's affected them, The organisation will offer regular weekly group sessions, as well as specific sessions for mothers and activities for children. It's important to remember that your outcomes are specific changes that occur as a result of what you do. But as you can see, one output can help to bring about a number of different outcomes. However, it's also important to do more than just list your services and activities. You should provide a description of your model of service, i.e. what your services involve and what they look like, so that they can be properly understood. So step 5 is then about thinking about your inputs, the resources that you'll need to deliver your activities or produce your outputs. So in the NSPCC's case, in order to deliver the weekly group sessions and activities, they will need skilled staff, funding, and venues, amongst other things. The final step is to think through the assumptions that underpin your theory of change. You need to ask yourself, what are we assuming or relying on in terms of both the process itself, so what do we have evidence for or not have evidence for in terms of the way we've ordered our outcomes, and in terms of the context in which we're operating, what else might affect the work that we're doing. So, for example, the NSPCC may be relying on partner agencies referring suitable families to them, on women and children engaging regularly in the programme, and on women's lives not being disrupted by other issues such as their accommodation or health. Thinking through your assumptions is therefore helpful in terms of understanding both what you need to evidence and also how your work may be affected by factors that you cannot always control. Finally, it's also important to test out your theory of change once you've developed it by consulting with your service users and other people who have a good understanding of your work to see if they feel it reflects the way that your organisation works and the difference that your work makes. To finish, we've compiled information on some sources of further guidance and support with developing theories of change. So we hope this has been helpful, and do get in touch if you have any questions or feedback for us.